Okay, hi, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment first. And as we look here at the anterior horn of this medial meniscus, it looks pretty good. Right now we're just using that instrument you see that's spinning around. That's our shaver. But we're using it more because it has suction attached to it and it helps us just flush out the knee. Table down just a little bit, please. And so now we're getting more towards the posterior horn. Great. And that looks pretty good. The articular surface of the femoral condyle also looks like it's in pretty good shape. We'll look up at it a little bit better. Yeah, and so far so good there. I'll show you some more in a minute. Okay, so now we're just getting to work on a lot of soft tissue that's in the notch here. And now we're getting a good look here in the central part of the knee. So it's obviously very vascular. I don't see anything loose yet. That's the medial side over there. And as we look back here, so far this is actually tracking pretty good here. It looks pretty good. That questionable loose body, let me rotate the camera around a little bit. That questionable loose body was going to be right down in here. Do you have a probe? Maybe I'll use that in a little bit. But here's your graft coming out of the tibial tunnel. That's your cruciate graft. And it looks like it's still well attached up here. And again, nothing loose so far. And now we're going to look in the lateral compartment in a minute. Hold on a second. Okay, so now we're looking in the lateral compartment. I'm going to back up a little bit. This is where you had your lateral meniscus repaired. And so we can see here you still got, the sutures never go away. And so we can see the suture material here. There's one there. The root is fine. You've got some degenerative changes already in the femoral condyle up above. You can see that above the shaver. And, the situation here is, as young as you are, I really don't want to take away any meniscus unless I absolutely have to. We're going to go ahead and put our shaver in and see if we can't smooth this out right here. Okay, so that looks a little bit better. I'm just wondering if there's a little bit of a split here. We're going to look down at it. Again, the last thing I want to do is take away any more meniscus here. Okay, and so now it looks like this meniscus has tried to heal. I see probably 3 sutures in it, including this more horizontal mattress suture here. And as I turn on the suction, none of that looks very unstable, so I'm hoping our PRP injection helps with the vascularity there a little bit. Okay, pause. Let me see that straight basket. Okay, so now we're looking in the patellofemoral joint, and we have something very interesting to see here. You have this, for lack of a better term, speed bump sitting right where the patella is supposed to go. And I can't imagine a world where that's a good thing to have, where your kneecap needs to glide. So there's a pretty good look at it. And so we're not supposed to have that in our knee. I am going to debride that. Even though it's cartilage, it just looks like there's been some extra growth here. And so we'll run the video a little bit and show you how we take it down. But no question that was causing some of your symptoms. There really isn't an injection invented yet that could do this without surgery. We just have to debride this down. And that looks better. Certainly looks like it would hurt less. All right, I think we're getting close to being done there. The less I take off, the better, but I just want to make sure there's nothing that's going to aggravate your patella as you walk. Okay, so this is the lateral gutter. I just wanted to show you that we had a look down here. It's inflamed. You can see how red it is, but I think that's just because the knee's been so aggravated because of what we just debrided, that little chondral thing in the central part of the knee. So here's the area where you had the speed bump, and now it's debrided back down. Medial gutter over here is also clear. No loose bodies down here. Okay, so I think we're just about done with the arthroscopic portion of the case. Just want to make sure there's no flaps that we're leaving, but that looks pretty good. Of course, you've got some wear and tear changes on the undersurface of the patella as a result of this. Okay. So the next thing we're going to do is we're going to take our PRP and see about doing this injection into the proximal patellar tendon where you have a partial tear.